Hello, I'm Nisreen. I'm one of the doctors in the clinic today. Can you confirm your name and age, please?
I'm Amanda Jones and I'm 28 years old.
Hello, Amanda. I understand that you are here today because you want to be sterilized. Is that right?
Yes, that's right.
Okay. Can you tell me why do you want to be sterilized?
Well, I've already completed my family and I don't want any more children.
Okay. So I will address your concern in a moment, but can I ask you a few questions just to know more about you?
Yes.
So, Amanda, can you tell me more about your periods?
I don't usually get periods because I'm on mini pills.
Okay. And do you so for how long you are on many pills?
Around 2 years.
Okay. And do you have any problems with that?
No, but I don't want to keep taking medication every day. I just want it to be over with.
Okay. And do you have any other problems in regards of um, you been ever diagnosed with infections in your pelvis or any infection from down below like sexually transmitted infection?
No,
And what about your smears?
I had one and it came back normal.
Okay, that's good. And can I ask you about your pregnancies? Have you ever been pregnant before?
Yes, I have two children, one boy and one girl.
Oh, lovely. And what was the mode of deliveries?
Both of them were by C-section.
Okay. And do you have any complications at all in your pregnancies or in your deliveries?
No,
That's good. And do you have any previous surgeries apart from the two sections?
no,
Okay. And otherwise, you are fit and well?
yes,
Any allergies?
no,
Um, are you taking any medication on a regular basis?
no,
Okay. And what about your social history? Like, do you smoke? Do you drink alcohol?
no,
Okay. Any family history of concern you want to explore to me?
no.
Okay. Thank you for this information, Amanda. I just want to ask you one question, and it is raised because you are like quite young person and you are requesting sterilization and you only have two children. Why don't you think of alternative contraceptions?
Well, I'm actually very sure of my decision, but I have a special request. If I do get this treatment, I don't want my partner to know because he didn't have any children before.
Okay, so how long have you been together?
Around 2 years.
Is he supportive?
Yes, he's very supportive.
So, Amanda, feel free to talk about anything. It's totally confidential. So, whatever we are speaking now will be totally confidential. No one will know about it. Do you really feel like unsafe at any time while you are at home?
No, it's nothing like that. He's actually very helpful and supportive, and he loves my children. But I feel like I can't handle getting pregnant again.
Okay, in that situation, it's just my advice is to discuss it with your partner. Will be more useful. Uh, However, no one can force you to take any legal requirement or any partner permission for being sterilized. But for just have a chat with him, and it's better to discuss this with him.
I'll have a think about it.
Okay, so do you mind if I explain to you what sterilization is and what are possible alternative contraceptions?
No, I don't mind.
Okay, so first of all, let me talk about sterilization. It's one of the long term, or we call it little bit permanent contraception, uh, because it can the reversal of this sterilization is very very difficult. Okay, so the advantage of this kind of sterilization is that it is like long term and it will not affect your hormones level and will not affect your sexual desire um, but it has some side effects. Uh, there is no contraception method which is 100% effective. There is still a failure rate, so any method can fail to work. And actually we have a failure rate of sterilization of 1 in 200, so it's about 0.5%. So sometimes if you get sterilized with this surgery, it will not work and you may get pregnant. That's because sometimes these ligation or ligated tubes can be recanalized and it will work again. Sometimes if you get pregnant, this pregnancy can be outside your womb. We call it ectopic pregnancy, which is quite serious. Um, it's also one of the complication, as I told you before, that the reversal of this surgery is very very difficult and is not usually done in the NHS and can't be funded, but you can do it like in a private practice, and sometimes it may not be successful, so you have to be sure of your decision before we go ahead. Okay.
Yeah, I'm very sure of my decision.
Okay, and let me continue about the complication of that is not protective against infection inside your pelvis or protective against sexually transmitted infection. So if you are exposed to kind of these things and you need protection, you have to use a condom as well. The procedure is done through, we sometimes go with a keyhole surgery, which also have certain risks. First of all, the anesthesia complication, because it's an operation, and while we are going, it's a keyhole surgery. Are we going? Sometimes we may hit any organs from around the womb, like the bowel, the bladder, or sometimes the ureter as well. And sometimes you may be exposed to bleeding internally, infection, and it's some sort of operative complication. However, it's a keyhole surgery with a rapid recovery if it went well. So thinking about it, it's it's an operation, and also it carries a failure rate, and we have some alternatives which have less failure rate than this method. I will start with the Mirena coil, which is a coil fitted into your womb, and it will release some hormones daily, and its failure rate is much lesser than this tubal sterilization. It's 1 in 1,000. So what do you think about it?
No, I'm not too keen to have a coil fitted.
Okay, that's fine. That's up to you. And what about if we offer you some injectable progesterone, like monthly injection or 3 monthly apart?
Well, I have a phobia of needles, so that won't work either.
Oh, okay. We still have some alternatives. We have what we call subdermal implant, where we put a very tiny plastic capsule in your arm under the skin, and that also releases some hormones daily and will protect you against getting pregnant, and its failure rate is very less. It's 1 in 2,000. What do you think about it?
Well, I tried it before and it caused irregular bleeding. Can I just get the sterilization treatment?
Yes. Okay, that's fine. We will do whatever you want because this is your choice. Since you understand the benefits and risks of all the available options and you choose this option, we will go ahead with what you choose. But because you are a little bit younger than we, we usually offer this treatment when you are 30 and more. I may refer you for a second opinion for another consultant clinic to have a further discussion. And in that situation, if you are still sure of your decision, we may go ahead. So I can also give you a patient information leaflets about the sterilization, about the laparoscopy, and also about the other alternatives, which are the long-term contraceptions. You can read about it, and also I will give you another appointment in around 6 to 8 weeks. Um, my advice to you is to continue use your contraception until we take a decision about your treatment. And if we decided to offer you this sterilization, you need even to use the contraception till you get your next period after your sterilization. And we may offer you a pregnancy test on the date of the operation, just to ensure that you are not pregnant. How does this sound?
That sounds fine. Yeah, I'll read it and I'll come to the appointment.
Thank you. So do you have any questions?
No.
Okay. So I'll arrange for your appointment. Thank you.
Okay, thank you.